Hi.
Hi.
I have just us right now. So I'm making sure, Ryan, you're a co-host. So if anything goes weird with our internet over here, you are able to seamlessly keep going. And we had 117 people register. So
Awesome.
yeah, I'm pretty excited. Are there any questions on the program?
No, I think I have a pretty good handle on it. Do you like at the very beginning, do you want me to just take it from there, or do you want to kind of welcome people and stuff?
That's a good question. I was thinking I would welcome people, just remind folks of the community standards that I just shared in chat, and then then hand it over to you to kick us off, to talk to run the conversation. I think we should also do a quick little overview about like Marked by COVID's task force work, which I'm happy to do if you think that's right, or if you want to do it, that's fine too.
Yeah, I mean, I'm happy to give like a really, really brief introduction of that. One question I had is, do you want to leave time for questions for folks?
Yeah. And I'd like the last like 10 to 15 minutes be for us to really walk through the Action Network action and make sure everybody does it and everybody feels comfortable using the share feature so that they can share it with more people. So I was imagining it's like 45 minutes of actual program with like 10 to 15 minutes of questions.
Got it. Okay.
All right, cool. Well, I then will let folks in. Hey, we're letting folks in from the waiting room right now. Really looking forward to being with you all today in this really important conversation about the COVID-19 task force work, as well as our special guest speaker who will be joining us momentarily, Dr. James Lawler. Oh, there he is. So before we jump in, Lucy, so good to see you. Sarah, you too. Amanda, good to see you. So great to see so many familiar faces as well as new faces in the crowd. Marie, great to have you here. I'm going to take a minute up at the top just to review a couple of the housekeeping pieces that we just shared in the waiting room. We are recording this and it will be available publicly on our YouTube channel. So if that's an issue for you, take what action you need to right now to be comfortable with that. And then during the conversation itself, we just have a few community agreement standards of basic things that we all try to practice anyway, of being kind and courteous, no hate speech or bullying, no promotion or spam. The program itself, we'll have an overview quickly of Marked by COVID's role in helping to bring about the need for a COVID-19 task force, but we'll devote a majority of the time to being in conversation with Dr. Lawler about his experience, have time for questions, and then at the very end, we'll save the last 10 or 15 minutes to make sure that everybody knows what concrete action you can take to help us get this work over the finish line. So those are the housekeeping tips for all of us. And for folks who may not know me, my name is Kristen Urquiza, and I am the co-director of Marked by COVID, which is the nation's largest network of COVID grievers working for pandemic justice and remembrance. And I'm going to pass it over to Ryan Pukos, who is our volunteer policy lead, to really take it from here about our work in this area and then leading us through our conversation with Dr. Lawler.
Sure. Thank you, Kristen, and welcome everyone. So I'm going to just to give you a sense of how this is going to go. So the main thrust of this meeting is going to be a conversation between Kristen and Dr. James Lawler. But I want to a lot of that conversation is going to be about our work to push for the creation of a COVID commission or COVID task force. So before getting into that, I just want to give just a little bit of background about our work in that area, because it's since really the end of 2020 and really the very beginning of the pandemic, it's been a top priority for marked by COVID. So just to kind of give a brief overview, we, in our original version of our policy platform that we launched in early 2021, we were among the very first groups in the United States. We actually think we were the first. We haven't been able to identify anyone who was before us in calling for the creation of a COVID commission. Kristen appeared on Chris Hayes's show, and was one of the first to call publicly for the creation of a commission that will investigate the government's response to the pandemic, and kind of compile the truth of what happened, and then make recommendations around making sure that that we never find ourselves in this place again. So following that appearance that Kristen had, we were contacted by some folks, including some folks that had worked on the 9/11 Commission following the years following 9/11. And Kristen was invited to be a part of the COVID crisis group, which was a group that was formed to do really the prep work for an eventual COVID commission. And it was some of the country's foremost experts on public commissions were behind it. And in fact, that's actually, I'll let James introduce himself, but that's actually how Kristen and James met, through the work with the COVID crisis group. So kind of just all of the history is very important, but I'll make this brief. We've supported a few federal efforts over the last few years. Most recently, we have been running a campaign of support around a bill that is being considered in the Senate right now, that is sponsored. It's a bipartisan bill that would create a COVID task force. And we have been organizing both a letter writing campaign, which Kristen will talk about at the very end of this call. And we also have gotten, I think, are we at about 50 organizations now that have signed on to support the bill?
That's right. Yeah, we're just around 50.
Yeah, so our original goal was 30, and so we think we're doing pretty well. So with all of that, I want to jump right in here. And actually, why don't we, before we get started, I want to give James just the chance to introduce himself.
I'll turn my camera back on. Thanks so much. Hi, everyone. I'm James Lawler. I am an infectious disease physician at University of Nebraska Medical Center, our global center for health security. And I met Kristen and the rest of the Marked by COVID team, as Ryan said, through the COVID crisis group, which was set up by Philip Zellico and a few others to try and create the nidus for a commission to formally investigate is a pejorative sounding word, but at least to explore what happened during the initial response to COVID-19 as the pandemic evolved, and to understand where some of the failings and gaps that occurred can be addressed, and also to understand where things went well and where we can build on that.
Great. Thank you, James. So we have about the next 40 minutes or so to kind of explore a few different themes. I want to, I guess I want to just start because we were just talking about the commission. I just want to start there. So I guess just to begin, what can you both just talk a little bit about why you decided to participate in the COVID Commission Planning Group, and also just generally why is a task force necessary?
Kristen, do you want to start?
Yeah, I'm happy to do so. I think the thing that was top of mind for me in the days following the death of my dad was that if we didn't actually seize the narrative on what was happening to us, that this part of history would be essentially whitewashed, like all the other parts of history that we're struggling with right now to recognize as just what the actual historical record was. And when I was approached by Dr. Zellico Phillip, I was familiar with the 9/11 Commission as sort of a model to look at. So I knew that it was a legitimate group of organizations, and I was really impressed by their and his specifically commitment to ensuring that first-person accounts, that the lived experience, that the impacts of COVID on people's health, like long COVID, as well as our families, like COVID death, were part of this investigation. So I wanted to be able to be a part of that on behalf of our community.
So I was first approached by the group in the summer of 2021. And I think that part of my motivation at that time was understanding that there were plenty of lessons that we could draw from the response to date that we could address and implement new corrective actions at the time to change the course of the pandemic. People, if you remember, summer of 21, we hit a pretty significant low, actually lower than community activity currently is. And so many people were writing off the pandemic at that point, thinking this is the end. And so I honestly think many people who were engaged in the COVID crisis group were of that opinion as well, that we were going to write the epitaph. Several of us thought that this was an opportunity while we were in the eye of the storm, so to speak, that we could make some course adjustments and help with the next phase of the pandemic. That proved to be, I guess, an optimistic view. But I still think that a formal group exploring the lessons learned from the pandemic is critical. This was obviously and continues to be one of the most impactful events, certainly in our lifetimes, and probably in the last century, in terms of the number of Americans who've been lost and families who are grieving, the number of Americans who are suffering from long COVID, and the social and economic and political consequences of the pandemic, which I think are still dramatically underappreciated. So the ultimate goal is for us never to allow this to happen again. And if we're not going to allow this to happen again, we really have to understand the root causes of what happened this time around. Why did we? And I'm guessing in this group it's okay to say, but I get a lot of dirty looks when I say this. We have failed miserably in our response. And we have to understand why that is. And we have to take an honest look in the mirror at why that is. And nobody's going to like the answers, which is really one of the reasons why there hasn't been a formal commission. That's why the White House and Congress and really nobody in Washington truly wants this to happen. It's being used as a political football to score points. I think, Kristen, I think you're more optimistic than I am at this point, but I'm older than you are, so I've earned my cynicism. I'm not sure that this task force is really ever going to get off the ground. I hope it does, but at the end of the day, somebody has to do it. And if it's not formally chartered through Congress or the White House, then I think it's up to the people to do it ourselves and to understand where the system is broken and how we can fix it, because ultimately, again, we cannot allow this to happen again. And this was not even necessarily this wasn't the high heat that Mother Nature can throw us. It was a nasty one, but it could be a lot worse. And so we need to be prepared for these types of events, which I think recent events would tell us are probably going to occur more frequently. We are going to see another pandemic, certainly in our children's lifetimes. I would guess in most of our lifetimes. So we need to be ready.
So I will say, for just speaking for myself, I kind of particularly on this topic, kind of bounce back and forth between being as pessimistic as you are that it'll actually happen, and then I think there have also been periods of optimism where it seemed like we've gotten traction. So I guess I would ask, what, setting aside kind of what you think will happen, what do you think it'll take? What do you think it would take to make it happen? Like what needs to happen to lay the conditions for the task force to be formed?
I think the conditions are already laid, and again, it depends on your perspective, and I think this is a place where many people who are part of the COVID crisis group, this kind of pre-task force that Philip Zelikow pulled together, I think it's been a journey or progress in perspective and thinking about how a commission might work. I think everybody assumed that this would follow the example of 9/11, and that there would be a formally chartered commission through Congress to explore. And I think that was certainly was Philip's goal, and I think was his full expectation. And I think that nobody even considered the option of doing some sort of commission or investigation outside of that formal imprimatur of the U.S. government. I think that certainly in our group, I think the the thinking of many has changed. And so I think I look at it from a broader perspective. An investigation, a commission, a task force could be set up and could be operating within weeks. The foundation is already there, and the work that the COVID crisis group did. And that was one of the reasons why we published the book of the findings of the work we had already done to create at least a platform where we could then start from there, or others could pick it up and start from there. Where could a commission with a formal charter start? I think it's probably in this legislation that's sitting in front of Congress now. But for Congress to actually function and do policy making and legislating and get things done would certainly be a departure from what they've been doing for the past couple of years. Miracles happen, right? Even in Washington, sometimes miracles happen. But I think it's time for all of us to stop putting our faith in Congress is going to fix this, and we should look at other solutions if Congress doesn't.
Yeah, I'll just jump in and say on that last point, well, on a couple of those points, I think James is absolutely right in that Congress has everything that they need to hit the ground running on day one. And that is a really strong position to be in. And what really is lacking is the political will to do it, because it is everyone's going to look bad. And in this group in particular, you can and should often say that our response was a complete and utter failure, because we are the big champions of that, because we're living with the consequences of that failure. There is no normal for us in this room and our constituencies outside of here. And I think that, that's for this particular legislation that we're focused on right now. I think it's our last best hope for a potential congressional task force, which is why we have decided to continue to push hard for it and organize a whole broad coalition of like-minded and allied organizations to be in solidarity with our community. Ryan was earlier talking about this coalition letter where we have nearly 50 organizations signed on, representing tens of millions of people. There are a lot of COVID groups on that coalition letter, but there's also groups like Oxfam, Avaz, Center for Popular Democracy, the National Occupational Safety Network, which represents tens of millions of workers that are behind the cause. So we are doing our best to showcase that this is an issue that many different interest groups care about, representing, tens of millions of Americans. If it doesn't happen this way, then I think, James is correct in that we'll need to kind of look back at, how do we rise to this occasion without Congress's support, without congressional legislation, without the administration's blessing. And that's just a disappointment, because I looked and there has been 170 types of commissions over the past 30 years. So this is normal, this is standard, this is part of what we do. And especially whenever we've invested trillions of dollars of our tax-paying dollars, like we owe it to taxpayers to be able to have an after-action review. So that's where I'm coming from on it.
Thanks, Kristen. And I think so we're good. We're going to come back to in particular to taking action with respect to the commission at the following this conversation. But so I want to shift gears a little bit. So I guess one of the things that has been now for a long time as the as the nation and really the kind of bipartisan consensus has pushed us toward, back to normal, pandemic is over, is that for virtually all of the people in this room tonight and many, many others that we're connected to, that we're living in a very different world as a lot of other people. Many of us are hashtag still COVIDing, or whatever you want to call it. So I guess the question is kind of, I guess I want to get you guys to talk about where you think we are right now, just kind of diagnose like the stage in the pandemic.
Oh, that's all Dr. Lawler.
Yes, well, Kristen knows that I can serve as a cautionary tale to the fact that the pandemic certainly isn't over. So I went 3.5 years without getting COVID, and then last week was in Puerto Rico with my team doing some work on a patient isolation device, and did something that I really don't do, which is go out to dinner in a crowded restaurant indoors without my mask. Monday I tested positive, and so now I'm on day 5, enjoying my delicious Paxlovid taste. But obviously, this is this is an example of how COVID is not over. We're not finished with the pandemic. We're in a different phase. And if you look at wastewater data, which is really now the only reliable information source we have for community transmission, we are nationally at a level certainly well above where we've been at previous naders, as I mentioned, summer of 2021, for instance. And I think we're going to continue to see episodic waves as new variants emerge, and certainly as school goes back in session in the fall, and kind of all of the conditions for respiratory virus transmission are optimized again. I think that we're now at a phase where these waves will probably be less impactful in terms of overwhelming health systems, but certainly for the individuals who get infected and unfortunately individuals who die or suffer long COVID, it will be quite impactful for them. And unfortunately, what we've done is really turned back the clock to early 2020, where we have almost zero visibility into COVID activity in the community at this point. And so the idea that we're really going to take any action or do anything about it, I think, is unfortunately that we're just not there anymore, because we don't have the visibility to do it. And honestly, we don't have the political will to do that, right? The pandemic has become a nuisance, and certainly a political third wire that nobody wants to touch. And so the feds have been systematically dismantling our ability to have visibility into COVID activity, because it's a lot nicer when we can just close our eyes and not worry about it. So we'll continue to have these epidemic waves. I think over time, as they will become less and less severe. It still may take a couple of years, though, before COVID reaches what we would consider potentially an endemic level. And that still is probably similar to flu, where we see seasonal waves and occasionally large waves that cause significant morbidity and mortality, until we get a better vaccine that has better durability of immunity and better protection against infection. I worry that one of the biggest unseen tolls of the pandemic has been the impact on kids, and obviously we've all seen the impact on school closures and disruption of education, and that is not deniable. And I'm not an advocate of closing schools, and aside from early in the pandemic in 2020, I don't think that was necessary. But we seem to have two modes, on and off. On is all schools are closed, off is doing nothing. And so now we're doing nothing, and we're allowing kids to get infected and reinfected. And I think that the health and developmental impacts of that are probably a lot more significant than most people recognize. And I think that that's a long-term health consequence that we are going to be dealing with, unfortunately. So that's to say we're certainly in the middle of the pandemic right now. Maybe we're closer to the end, the beginning finally, but we're still not in the last chapter, certainly. And there's a lot that we could be doing to improve our management and our ability to navigate. There's certainly a ton that we could be doing in improving indoor air quality in schools and in other public buildings and in office spaces where people work, educating people how to do that in their homes. And that could dramatically reduce the community impact of COVID-19. Also, lots of other respiratory viruses too.
I think on that last piece, that is something that I'm really excited about, increasing our capacity to be able to work on, because of the overarching benefits that we'll have not only to COVID, but to a whole host of public health issues, in particular that plague traditionally marginalized and exploited communities that have horrific or no ventilation in their schools and public buildings. Yeah, I think there's a lot of potential there for our community as well, to work in partnership with folks like Dr. Lawler and others who have the technical and research expertise to bring about the type of partnerships that can actually move the needle on these less politically divisive football issues that get us to similar goals.
Yeah, and actually, I want to jump in with actually a pretty specific question for you, James, which is, I'm wondering if you can talk just a little bit about kind of what your vision is for how we go about improving our some of the ideas that you have been working on and that sort of.
Sorry, Ryan, could you repeat that? You cut out for a second. How we can improve what was that?
I'm sorry. Can you hear me now?
Yes.
Oh, yeah. So I guess I was wondering if you could talk a little bit about just kind of your vision for how we go about improving air quality. What are some of the opportunities? What are some of the things that need to be done?
Sure. I'll tell you a story that was certainly enlightening to me. This was the summer of 2022 that I was, our team had been approached by the National Speech and Debate Association. They host the high school debate and speech national tournament every year, and wanted us to help them establish a safe environment. So the tournament last summer was in Louisville. So I went there in a pre-visit to assess many of the sites that they were going to be holding the event in. It's a huge event. I can't remember how many thousands of kids end up coming. I think it's 10,000 or so. So there's a spread all over the city where they're having these debates and speech sessions, and many of them are in schools. So they use the local schools, which are out for the summer. When we went to do the assessment, school was still in session, so it was great. It allowed us to assess these buildings while school is still in. And so I brought with me a carbon dioxide meter to be able to assess ventilation within the building and understand what's the level of exhaled breath inside these facilities. Now, that's something that Japanese public health authorities have been doing since early 2020, and they recognized very quickly how this disease was transmitted and how to assess indoor air threat and to mitigate that, looking at carbon dioxide levels as a proxy essentially for how much virus is floating around. That's still something that we haven't done, right? As a country, there's been very weak public health guidance about that. So getting back to the story, I go into these schools to assess carbon dioxide level, and ambient carbon dioxide level is, some may know, it's around 400 parts per million in the outside atmosphere. People start to develop symptoms related to indoor carbon dioxide levels. It's thought around 1,500. And so people start to report things like headaches, difficulty concentrating, getting sleepy as concentrations go higher than 1,500. The EPA does not allow workers to work in a space that has a level above, I think it's 8,000 parts per million. So I went into these schools to assess, how well ventilated are they? Are there things that we can do? Do we need to open windows, which is not easy in Louisville in the middle of summer, as you can understand. So many of these classrooms that I went into, again, I went into classrooms that did not have class actively going on in them, but classes going on around them. So these were not rooms crowded with 30, 35 kids. These were empty rooms, but again, with classes all around. And there were rooms that I was getting readings well above 3,000 parts per million. Again, an empty room, which means that the entire school is essentially a sealed box without ventilation, right? It just kind of blows a little cold air in there, but there's no air exchange going on. And so, one, it obviously shows you how high risk these buildings are in terms of COVID transmission. And we should all know that, right? There's no place in our communities where there's a higher population density than schools. Even prisons have a population density lower than schools. And this is where we put our kids every day. But beyond just the risk of virus transmission, we're getting to a point where we're putting kids in an environment where we have carbon dioxide and other volatile organic compounds that go along with that, by the way, that cause impairment of concentration, sleepiness, physical symptoms like headache, and that's where we're expecting them to learn. So to me, that blew my mind. That how is this? And Louisville, I don't think, is an exception, right? That these were relatively old buildings, and that's the problem. They're buildings that were built 50, 80 years ago. Often their HVAC systems were probably put in later and put in to create a minimum amount of air delivery, but no air exchange, right? Most of them, the majority of them, do not have modern HVAC systems, which do purposefully bring in new fresh air to blend in to provide better air quality indoors. So one of the first things that we could do is renovate the HVAC systems in these schools. And we could have done that, right, with the COVID money we had, right? With the trillions of dollars we spent, we could have put a new HVAC system in every school in the country, right? But we threw that money around like drunken sailors. I can tell you that what we did in Omaha is most of that COVID money for schools went to putting new roofs on schools. So nothing to do with COVID. But we're still in the pickle that we were in, where we have, a large proportion of American school-age children are sitting in schools for 6, 7, 8 hours a day that have very poor ventilation, no air exchange. And again, it's bad for their health. It's bad for their health for respiratory viruses, which it increases transmission of. It's bad for their health if they have asthma or reactive airway disease, because again, a lot of these other volatile organic compounds and other bad things that are in air that doesn't get exchanged are sitting there. And then it's negatively impacting their ability to learn and to concentrate, which all seems like a really bad thing. And nobody seems to care. So that's one thing that we could do right away. I mean, even before that, we could put in schools that have inadequate ventilation and air exchange, we could mandate that HEPA filtration units be put in every classroom so that you at least get the effect of having air exchange. At least you're filtering out some of the bad things like pollen and viruses and all of that that's floating around in the room, to at least create a safer space as you're addressing the bigger issue of how do we get better air quality into these buildings.
So, Kristen, how does Marked by COVID fit into all of this? I feel like some of this is it's pretty bleak, but I do think that there are some opportunities, and so.
I mean, we're the political will, we're the muscle, we're the folks that are, mobilizing through things like letter writings. We're going to DC next week to hold meetings with members of Congress, including we are meeting with Chuck Schumer's office, who's the leader of the Senate, the most powerful senator who sets the agenda to talk about our issues. And so I think the thing that has always made the needle move on these issues is, even when you have entrenched special interest with tons of resources and tons of money working to keep the status quo, is people who are saying not on my watch. So that that accountability piece of us being a watchdog group on this, organizing ourselves, bringing more people into Marked by COVID, that is all an important piece of keeping that drumbeat going on issues of importance, like enhancing our public health systems, getting ventilation in schools, because things just don't happen on their own. It's a combination both of experts and special interests, as well as the public getting engaged. And we've seen that happen on just the work that we have been able to put a little pressure into. We have multiple bipartisan bills in Congress. We've had, dozens of hundreds actually now of cities and states issue COVID Memorial Day bills. And that was because people in our network, reached out, shared their story, and asked that, that elected official, whether it was a city council member, a mayor, a governor, or a member of Congress, to do something about it. That's what makes our country work, is that type of civic engagement. And I have done this type of work my entire career, and I've never seen social change work be as effective as when it is a person who has lived experience, who directly knows the consequences of inaction, standing up before an elected official and looking them straight in the eyes, even if it's over Zoom, and saying, my loved one died from COVID. There is no excuse for not acting. Their death will not be in vain. And I need you to do the right thing.
So I guess we have about, I don't know, maybe a little bit more than 10 minutes, and I do want to leave aside time for questions. But I also just want to come back to you, James, and because part of I think in the email that Kristen and Christine had set out about this call, they had mentioned some of your work early on in the pandemic, repatriating citizens on the Diamond Princess. And I'm wondering if you can just just very briefly talk a little bit about your role, kind of some of the very earliest response to the pandemic in the United States.
Sure. Thanks, Ryan. So our team here at Nebraska has a long history of working in partnership with the federal government in emerging infectious disease response. If folks were paying attention in 2014, long before I got here, I didn't arrive until 2018, but our team here was one of the few institutions that treated patients with Ebola evacuated from West Africa. And our biocontainment unit was one of the first of its kind in the nation. Now we have a network or system of 13, which serve as regional hubs and referral centers. But there are 3 lead institutions that train the others. That's ourselves, Emory and Bellevue in New York. And so we've had these extensive partnerships with the federal government helping to develop standards for infection prevention control. And so when COVID started in January, we were already engaged and watching very closely as things were unfolding, and in fact, sending warning messages to everybody in the federal government that we could, telling them what was going on and what to expect. That's a different story. But in late January, we were actually the first academic institution to receive quarantined persons back from China. If you remember, as Wuhan was locked down, the State Department evacuated U.S. citizens and family members. And so most of them were taken to military bases. We actually were able to take a National Guard base outside of Omaha and to have those persons in quarantine here so that we could assist in the U.S. response. And then as we were in the middle of that quarantine activity, the Diamond Princess repatriation operation got underway. And so I was asked to help that team, which did not have a lot of experience in field infection prevention control. And so myself and a colleague of mine, Michael Callahan, went over there and accompanied them. And I think the important lessons of that and why that's important is it demonstrated a few things. First of all, it demonstrated the key of parts of the healthcare system being engaged in this full time in emerging infectious disease and pandemic preparedness, right? That was something that we took very seriously. It's a big part of what we do. We have an entire team dedicated to it. Most hospitals in the US obviously do not. And they don't because there's no financial incentive for them to do so. But because we had a team that was constantly training and engaged, that had experience in the Ebola outbreak in 2014, and also had lots of us have experience in Ebola and other hemorrhagic fever outbreaks in Africa. So in the field, we had a team that could do this and was ready. We also had a team that was interested in research in this area and could operationalize research very quickly, which is not something, again, that's very common either across the government or in academic centers. So when we brought those Diamond Princess patients back, we were able to immediately do studies to understand what was environmental contamination, what was aerosol contamination. So we very quickly picked up the fact that there was airborne virus in the rooms and even in the hallways outside of the rooms where we were caring for these patients. We're able to characterize that risk pretty quickly. And so by the end of the Diamond Princess operation, I like to tell people there's that book, if you remember, Everything I Needed to Know I Learned in Kindergarten. For the pandemic, essentially everything we needed to know about COVID, we learned with the Diamond Princess, right? So we understood, but from our experience and assessment going on board the ship and looking at the epidemiology, and again, from doing the studies we did when we brought the patients back, we knew it was highly transmissible. We knew that it had a relatively short incubation time and quick doubling time, so it was explosive. We knew it was probably transmitted by aerosol. We knew it was most likely transmitted by people who were asymptomatic, or at least who had not yet developed symptoms. We knew a lot about the clinical course effect, that seniors were much more vulnerable to severe outcomes. We learned a lot talking with our international partners about how to manage those patients early on. We already knew that proning was a good strategy to reduce the necessity of intubation and ventilation, and also to manage people on the ventilator better. We got that because we already had a network of international partners in Singapore and in Seoul and even in China that we talked to even before the Diamond Princess evacuation was complete. And so all of those things put us in a position to be able to respond effectively and to take appropriate action. So our hospital, from day one, every single healthcare worker who cared for a COVID patient had an N95 respirator on. We also had a stockpile, and we were able to develop a recycling process using ultraviolet light. So we never ran out. We put all of our COVID patients in respiratory isolation rooms. When we didn't have any more respiratory isolation rooms, we had our facilities engineers redesign the airflow on wards to make them negative pressure. And we were able to do that with about 8 wards in our hospital. So we had incredibly low occupational infection rates. In fact, we did not have a known occupational infection in the first year of the pandemic. And so these things are possible, right? If you're prepared and you have a health system that's working towards preparing before the emergency happens. And I think that's the lesson of the Diamond Princess that's really important from my perspective, right? A, we had a team that was prepared. We'd been working on this for years, decades. B, we went there on the ground, saw what was happening, and we did the research in real time to validate what we were seeing. And C, we had connections and partners already built internationally, which was hugely important, but also domestically, right? We had our partner regional special pathogen treatment centers who, along with us, went out and started evangelizing how to do infection prevention control, how to do N95 recycling and reuse. There just weren't enough of us. So we need to build on that capacity that we already had.
So I think, so I guess we have just a few minutes for questions. We probably only have time for maybe 1 or 2. But if you do have a question, do you want to raise your hand? Let me just see.
Let me, Ryan, jump in and just walk us through really quickly the action that I want to make sure everyone takes, and then we can use the rest of the time for questions. How does that work?
Sounds good.
Cool. So on that last note, I put this in chat and I see that it's getting a lot of love. And I'm just going to read it out loud. Paraphrasing Dr. Lawler, we knew what we needed to know from the Diamond Princess. That's why we need a task force. That needs to be the record. And we knew what we needed to do, and we refused to rise to the occasion. And I think that hearing you say this again reminds me of when I first met you in person and how validated I felt, because it didn't have to happen the way that it did. I thought of Lucy, who lost her husband and her sister-in-law and her nephew and her mother-in-law to the virus. She didn't have to get sick. There's so many of us who didn't have to go through what we went through had we just acted with the knowledge and the situational awareness that we had. And so having you, Dr. Lawler, be here with us, share that, it still hits that part of validation that we've been yearning for, we need, and just continues to sort of feed the pit in my stomach that we were wronged, and we cannot allow such gross negligence to happen ever again. It's the last thing that we would want to pass on to our children, our grandchildren, future generations, and beyond. So in order to rise to that occasion, I'm going to ask everyone to, if you haven't already, take a simple action, which is sending a letter to your lawmaker that only takes a few clicks. You're seeing my screen right now. Christine will in chat provide a link. This link takes you to this page, which auto-generates a letter that will then be sent to your senators to ask that they support this legislation. I'm going to be in DC next week meeting with a whole bunch of senators. So having you all make sure you complete this action, but then also take the next step and ask others in your network to complete this action is exactly the role that we need to do to be in solidarity with one another. And as you can see here, it's super simple. You fill in your name, your last name, your email address. You need to put in a street address, a city, and a zip code so that the program can find your actual lawmakers. And then you just click on Start Writing. You have to pick, and this is because of the lawmakers' websites, you have to pick one of these prefixes. I'm sorry that they are not inclusive. This is their website, not ours, our lawmakers. Underneath a letter topic, this is just for general sorting. I typically pick healthcare or something like national security. If it's an option, it typically isn't. Natural disasters, that's a good one. A phone number. You can make one up. This is for them. They don't ever call you back. And then there's an auto-populated letter, which you can edit to your heart's desires. You can put, you know, my name is Kristen. I lost my father to COVID. Or you can just continue to use this. You click on send your letter. It then generates letters to both of your senators and goes to a page that is a thank you page. And if you have the means to support this cause by giving a small contribution, you have the opportunity to do that here. So I hope that everybody can, if you haven't already, do this simple action and then ask at least one other person in your network. It could be a loved one, it could be a friend, it's somebody else that you know who's in the still COVIDing community or beyond to also take this action. We've generated 5,000 public comments in the course of the last month. We want to continue to raise the bar on this. So I will leave it at that and pass it back over to Ryan for questions.
I'm muted. Let's see. Jeff, you want to go ahead?
Sure, it's my privilege. Jim, thanks for being here. I'm a retired family doc, and I was in the public health service 50 years ago. So I know a little bit of epidemiology. Also, when I started in medicine, 10% of my patients in Boston had active tuberculosis. So I know about aerosol spread. And I really want you to, well, first of all, thank you for the great job you did. I certainly recall from the early pandemic, the situation where people were being repatriated and the State Department overruled the CDC people and mixed up the infected with the uninfected people. So that was early on, and I had this horrible feeling in my stomach, which you must have had. And I would like you to share a little bit further. So there you were with Insight in January or February, and you tried to tell responsible people what they needed to know. Who did that? What was the direction that they passed that information, and what was the response they got? How did that really come down?
Wow, Jeff, that's a question that could have hours of response. If you haven't, well, I will start by saying that there were a lot of people that we talked to who listened. Certainly those folks in the government that we had worked with before. And I should admit that I am a recovering Fed. I was in the Navy for over 20 years, did mostly infectious disease related research and policy work, but I was part of the White House team that developed the original pandemic implementation plan back in 2006 and 7. So, honestly, you can blame me for our bad response, because we did not fix the federal government in a way that it could respond appropriately. However, if you read Michael Lewis's book Premonition, you'll get a lot of the story of the group of us that were talking to federal officials and what happened. So we were able to reach a lot of middle management folks, but a lot of senior leadership were not listening. And obviously, if you remember, in January of 2020, a lot of other things were going on in the White House. And so as with every White House, these are political calculations that the pandemic really didn't make it high into their priority list at that point. And I'll point out one last thing, is that we, again, as I said, when we look in the mirror, we're not going to see a lot. We're not going to like a lot of things we see, but we need to be honest about that, right? I will posit to you, well, first of all, I'll posit to you that it's not politics that messed up our response. It didn't help. But our systems to respond are fundamentally broken. And I don't care if it was Barack Obama, Abe Lincoln, or whoever you want to put in the White House, we still would have failed. And we would have failed because our institutions that are charged with protecting us against these types of events didn't work. All right. So I went to CDC and I met with them after the Diamond Princess. And I had arguments with people about whether there was community transmission going on, when any epidemiologist with any sense in their head knew that. I tried to test people that we brought back from Wuhan, because we had a molecular test that was working at the time in late January. Nobody else did, but we have an awesome molecular diagnostics expert. And I was blocked by the CDC. They would not let me test those people to see whether there was asymptomatic infection. So those were the real problems, is our institutions that we have to address these problems don't work. And we haven't done anything to fix them yet.
Thank you.
I think I want to be respectful of everyone's time. We're almost at time, but I see one more hand. So Amanda, do you want to go ahead?
Yeah, thank you so much. Where do you think the disconnect is? Because I see people at the CDC who are just as frustrated. It gets so far. And what do you think the role of medical anthropology might be in all of this? That's my background, and I think that's a crucial thing that we're missing.
Agree. And maybe this is a job for anthropologists or sociologists to understand why the CDC acts like it does. I have friends in the CDC. There are some of the best minds in medical science and infectious disease who work at the CDC, but collectively, I think culturally one of the issues, and again, this is a question that could take hours to answer, so I know we only have a minute, but CDC's inherent culture is very academic, and they pride being right, and they value being right and precise more than anything else. And that's great in day-to-day public health. In fact, that's probably a benefit. In an emergency, that is catastrophic, right? Because the important thing in an emergency is to be fast, and they cannot be fast.
Thank you, James, for joining us. Everyone else for your incredibly engaging conversation in the chat and thought-provoking questions. We will be also sharing this on YouTube and sending it out to folks who registered but weren't able to make it, as well as all of you, so that you can go back and kind of take notes. But I think I want to say on behalf of the community, this is a really triggering and hard topic, but we, because it's our lives that have been ruined as a result of what happened and what didn't happen. And I know I said this a little bit earlier, but the validation, you being here, spending this time with us, is just oxygen to our purpose and our soul, and quite the antidote to the multiple years of gaslighting that we did our best, that we put our best foot forward, that it's over, when in fact that it's not, and it hasn't been. And there has been catastrophic consequences that have forever changed the fabric of who we are as individuals and as a country. So it's been so inspiring to get to know you, to have this conversation. And I hope that this is just the beginning of more times in which we can engage and bring you into this space and continue to work alongside you.
Well, thank you, Kristen, and thank you for your advocacy and the work you do, and thank you to everyone in the group for your work. I know that this is something that's really important for you all, and I applaud your efforts in continuing to highlight what we need to do as a country. Kristen, I know I saw a couple of questions that I didn't get a chance to address in the chat. If you want to share my email with folks, that they can feel free to email me, and I will try and respond in a timely fashion.
Absolutely. Thank you. Will do with the wrap up. I also shared earlier, and I've shared on the Marked by COVID Facebook group again before, Dr. Lawler's institution has a really great weekly communication called The Transmission. I also recommend folks sign up for that to keep abreast of not just what's happening on COVID, but a whole host of other hot topic issues in the infectious disease world. And there's always typically something really amusing at the end of the newsletter as well, which I appreciate because it's heavy topics. It's a heavy topic. And Ryan, thank you so much for your continued support and moderating this really amazing conversation. So with that, we'll let folks go. Have a wonderful evening, and stay tuned for an email with updates on this. And do not forget to take action with that letter. And if you've already signed the letter, ask one other person, just one, to also do it as well. So have a good night, everyone. Talk soon.
Bye.